Heart failure or palyadong puso affects 1 in 5 people over the age of 40 and is the most common cause for hospitalization for those aged 65 and over. Now, to give us more insight on this silent killer, we have Dr. Ludon Antonio. He is a clinical cardiologist in the Asian Cardiovascular Institute of the Asian Hospital and Medical Center. Welcome to the show, Doctor.
Thank you, Dr. Freddy.
Now, what are the more common causes for heart failure?
Okay, let me begin by saying that heart failure is actually, as defined, the inability of your heart to pump blood efficiently. As you mentioned earlier, the prevalence increases with age. In other words, it is more common in the elderly, although it affects all age groups. It also affects the two genders. Now, with modern medicine and technology, people tend to live longer. We have more chances of surviving your first cardiovascular event. So the number of heart failure patients is actually expected to increase in the next few years. Now, you ask about the more common causes. The list is actually quite long, but the more common causes of heart failure are hypertension, diabetes, valvular heart disease, that's faulty heart valves, arrhythmias or irregular heartbeats, infections, certain substances like cocaine, alcohol, chemotherapeutic agents, the ones that are being used to treat cancer, can cause cardiomyopathy. Pregnancy can also cause heart failure.
So these are a lot. There are several
but
factors.
the more common, or still the most common cause of heart failure worldwide is still coronary artery disease.
Okay. Now, are there any other associated risk factors associated with heart failure?
The more significant risk factors for heart failure are those who have hypertension, or should I say uncontrolled hypertension, and coronary artery disease. So if you have one or both conditions, go see your doctor right away.
Now, how is heart failure diagnosed, doctor?
Most patients with heart failure will have varying degrees of shortness of breath, easy fatigability, so you may experience inability to carry out your usual daily routine, unexpected weight gain, lack of appetite, palpitations, or leg swelling. So if you have, again, any of those conditions, you see your doctor right away. Now, your doctor, depending on what he thinks is the probable cause of your heart failure, may request a variety of tests. This will include a blood test, CBC, to check your hemoglobin level, to check also for infection. We also look for your thyroid function, your kidney, your liver function test, your blood sugar and blood chemistry. The more specific ones are ECG to the echo and chest x-ray. So it all differs from case to case.
Now, doctor, what can patients expect knowing that they have probably some of these risk factors and they decide to have a checkup with you? What can they expect on their first visit?
All right. Well, in Asian Hospital and Medical Center, we recently launched our very own heart failure clinic last November 29, 2018. The goal of which is ultimately to improve the quality of life of our heart failure patients. Now, how do we do that? By providing them with evidence-based, guideline-directed best practices that encompasses the different specialties. So that includes your nutritionist, your dietitian, your pharmacist, educators, heart failure nurse, the heart failure doctors, and the cardiovascular specialties, the cardiovascular surgeon, the interventionalist, the electrophysiologist, all working together to provide you with the best possible outcome. Now, for obvious reasons, the management, the specifics of the management will vary from case to case depending on the etiology.
Right.
So they may range from as simple as education, like for example, dietary restriction, so that's salt and water restriction for you, adequate weight management, blood pressure control, to the more advanced use of mechanical circulatory devices, the LVADs, the implantation of pacemakers, the minimally invasive cardiovascular surgeries, we have it here, angiogram, angioplasty, the transaortic valve replacement, mitral clipping, to the open heart surgeries, bypass surgery, valve replacement, and including heart transplantation.
So all of these that you mentioned seems to be that you don't just treat the patient with just their ailments, their heart, but you treat the patient as a whole here.
That's right. With the use or with the availability of the different specialties, all working together to provide you with the best outcome. So with the patient, of course, at the center.
Now, how does the Asian Cardiovascular Institute here at Asian Hospital compare to the rest of the world?
We have a saying here in Asian Hospital, Tatak Asian. So that's more or less a personalized touch of giving our patients the personalized care, a more compassionate approach in treating their management or treating their case.
Now, with this being a Heart Awareness Month or Love Your Heart Week, are there any certain activities that we can watch out for here at the Asian
Yeah,
Hospital?
thank you for the opportunity. Internationally, February is known as Heart Health Awareness or Heart Awareness Month. So here at Asian, we have prepared a week-long celebration. We have prepared several activities, one of which is medical consultation and clinics. We also have a symposium. This year's theme is Love Your Heart. And so if you are and your viewers are interested to know more about heart failure, come join us celebrate Heart Health Week in Asian Hospital.
Especially those who have their own medical practice or the other cardiologists will be able to see these symposiums as a benefit for them.
Of course.
Thank you again, Dr. Lu, for sharing your expertise and sharing with our viewers as well what you have in store here at the Asian Hospital.
Thank you for having us.
And that's all the time we have for this episode. Please join us next time as we give you more topics that help take control of your health. I'm Dr. Freddy Gomez. Thank you for watching.